Okay, here we go. All right, so hey, welcome everyone. So I have a really neat opportunity to talk with Carolina. Dr. Carolina, she is the founder and the CEO of Guimedic down in Guadalajara, Mexico. And it's a fantastic nonprofit, and they serve, boy, thousands and thousands of people in need every year. We partnered with her and them as we are serving and reaching the Huichol people north of Guadalajara. And so I just wanted to really begin by saying thank you and expressing our appreciation, our real heartfelt appreciation for allowing Mission Flight to come alongside you and your team as we did our first outreach with the Huichol people, and having you there was 100% essential, and having your reputation that precedes you, that goes before you. It seemed that most people in the village had heard of you or known of you, and when we had mentioned that we were coming, they were very, very enthusiastic to have you and your team come. And then we were able to kind of supplement your medical side with our dental side. And it was a real fantastic outreach, and it was a wonderful time of serving a lot of people in need that normally aren't able to receive medical care, and with eager invitations to come back. But now we're kind of struck with this COVID situation, and so there's been some limitations with the COVID, but you're still able to do a lot of outreach with your medical teams. So tell us how the COVID is affecting you and your teams and the outreach. You can go some places, but not others, or tell us about that.
Hello, first of all, good morning. Thank you, Mike, for this invitation. But that question is so important because right now we have a lot of cases here in Mexico, and it's been difficult for us to keep working for, I think, five situations, five things. First of all, for the federal government, we don't have support from them. They even trying to protect people are putting military people in the places that we are close to the indigenous communities, and they don't allow us to go there. They are blocking work that we are doing. So, and we're still having people who is dying, not just for the COVID-19, but for another kind of diseases. As we know, these people are part of the 55 million people who live in poverty here in Mexico. These people used to live in remote places without access to medical services. If they want to go to the doctor, most of the times they need to walk, and most of the people, almost like 86% of them, die trying to get to the doctor. And this is a reality. We was trying to help them. Now we are seeing how children lost their parents, and in the otherwise, how the parents are losing their children because they lack of everything kind of medical services. So in this way, this COVID-19 situation is affecting us because even the prices of medicine, medical equipment, PPI are higher than the usual. So we are spending a lot of money. And something that I want to share with you that happened to us like 1 month and a half ago was we arrived to one of the indigenous places. We was ready to cross the river using a boat, and some military people came to us and they took part of our medicines and our medical equipment just with the argument that they needed for the clinic who was near there, and they didn't ask for permission. They just do it, and at the same time they block us and they don't leave us to go to that community, and people was waiting for us. So how you can tell the people that you cannot go there to help them when this situation and all the context it's blocking you? It's sadly to see these kind of things because for me, personal way, it's not just my patients; they are my family, and I'm that kind of doctor who try to protect them. If and I can offer the services, even if I need to go or travel alone, that is not a problem. But this situation is doing a lot of stuff. Even we have 5 doctors who tested positive, so we put them in isolate mode. And in this way, we are having less volunteers, less medical doctors, and even if we are trying to hire more Mexican doctors, the kind of news that we are seeing on newspapers and the TV, it's making and creating fear even in the health sector area. And here in Mexico, most of the doctors don't want to work, not just for the pandemic situation, but because some people who don't have enough knowledge are even attacking doctors and nurses, and people are afraid to go out because people here in Mexico is thinking like we are the way to spread the virus, and people don't want to stay close to medical people or to people who work in a hospital.
Wow. And how often are your teams able to go out and still try to at least make attempts to reaching the poor?
In this case, we're trying to work every day in different places. We notice that places that are close to the city sometimes are easier to get there, but places that are remote, it's quite difficult because the military people is there.
Yeah.
They are working in a sense that suppose that they are trying to protect, but something that we saw, and it's important, is that the information about this virus, about this pandemic situation, don't go there. People don't know what is happening because they are living in remote places. And another fact that is important here is that not all these people who live in these indigenous communities speak Spanish. They have their own language. For example, in Nayarit, we chose Coras. Here in Jalisco, we have Riveritas, another kind of indigenous people. They don't have that information. And if somebody who travel from the community to the city get infected and they return, for sure that all the people who live there are going to be infected. And without having information, I think the damage will be higher and higher and higher. But we are trying to find different ways to go there. Even we are working with people who live there in a way that they are helping us to ask for permission, not just with the military people, but with people who is low in that place. With, for example, with the sheriff of the indigenous community, if they say yes, you and your team can come here. They are trying to help us to talk with the military people in a way to let them know that they need medical support.
Mm-hmm. Yeah. You and I have been talking about creating another level of partnership and of a financial partnership. And in Mexico, there's been some difficulty with the support and a lot of details with the government and lack of support really with the nonprofit, especially during the COVID times. And so, and then also with trying to bring finances in from the states and the bank fees and some of those issues. But Mission Flight is able to provide a no-cost vehicle for people in the states or really from other countries. Just to go to our website and find the Guimedic kind of designation and support directly 100% for what you are doing. What are some of the biggest financial needs that you guys are facing right now? What is the call? What are you really needing us to raise finances for mostly right now?
Thank you for that, right now, we are facing with the prices of the PPI, for the protective personal equipment, with the medicines, because we need to follow some kind of protocols in a way to keep safe and try to take the people just in the safest way that we can. For example, here in Mexico, we are facing that in some of the places that we used to buy the medicine, the medical equipment, and other kind of material, they don't have enough, and they are just selling this kind of material just to the hospitals and leave us without nothing. And we are looking in different places in different states here in Mexico or even outside how to buy that. And now the financial things just focus into get more medicine, into get medical equipment, because without we cannot treat patients. I mean, I need to protect my team because each doctor need to wear their medical equipment, and patients, they need to wear a mask. And another thing that is important here, for example, is that most of the medical equipment came from China. Like 1 month ago, we developed a protocol to treat patients in indigenous communities. We sent this to a medical journal, and they rejected because they thought that we are doing the opposite, according to the work, according to the who is trying to tell you how to treat patients. But we are doing clinically, and we are working in that way, and we are seeing how patients are recovering when they tested positive. And in this way, another financial issue that we have is that the COVID-19 tests are so expensive. If I compare dollars versus Mexican pesos, I know it's cheaper, but for us, even treating a lot of patients, because per month we have more than 1,000 patients. So each kit to detect COVID-19 is almost like $45. So that is our big issue, and it's the way that we are trying to see what we can do with that.
Yeah. And I know that not just getting these COVID tests and getting treatment to the indigenous people is very deep and passionate on your heart and on your team's heart, but you also, you carry a very important message of the hope of Jesus Christ, and that you always are very careful to very appropriately express God's love in meaningful ways. That's it's not too pushy, it's not inappropriate, but you have people available to pray with the patients, to share with them the message of the gospel and the good news, the hope, the healing power of Jesus, and that is something that we really value and appreciate as well. How could we be praying for you and your team?
Thank you. First of all, you can be praying for us about our health, because at the end we are exposed not just to virus, but from another kind of situation. For example, these kind of remote places used to have between the mountains drug cartels that are sometimes are dangerous. You know, that kind of people, they used to go where you are, and they are looking you, and they are trying to see what you are doing, if you are working there just because you want to help, or if you are getting information to give that information probably to the government or to the police. And in that way, well, it's part of the work, and we love to work there, and we know that we're exposed. And for example, another way is in the sense to protect us in the travel, because sometimes we need to walk more than 5 or 6 hours. We need to use boats, and we're exposed to any kind of accident, or even to a snake bite or another kind of insect that it's part of the nature there. So we need to have support, and the most important thing is to pray for our hearts. In which way? That this kind of indigenous communities, they used to have shaman. I think it's the correct word. They have different kind they believe in different kind of gods. So we are trying to teach them that they just can get a salvation in just one way, just accepting Jesus in their hearts. But sometimes for them it's difficult. And something that we saw in that kind of communities is when with people, when we show people, or even no matter what kind of indigenous community, accept Jesus in their heart, the other part of the community who don't accept it, they reject it, and they remove that small group from the community, and they need to find another or a new place to live. So we need to pray not just for my team in that way to protect us in our troubles and in our health, but to protect and to pray for people who is hearing the gospel. Because at the end, with these tough times, we need to keep praying. And even we are trying to make a translation in their own languages. We have we told Bible and use try to do it. I know that sometimes I cannot speak well because it's quite complicated to speak with all, but well, we are doing our effort in to share the gospel. And this is important because right now we are the vital link with the outside in these times. So they need to know the reality. They need to know why is happening this kind of things, and we need to try to save people not just in the health area, but in the spiritual. That is the most important, because at the end, the body we can get sick, but just God can heal. So
Yeah. Well, I just want to encourage those that are watching to be praying for you and those things, and also to pray about partnering and supporting you and your work. We're not able to, we're restricted. We're not able to come down and partner directly, but we can partner financially. We can partner in prayer. We can support you as you're able to go out to most of the communities. I know that there are some restrictions with the military police not allowing you to go up to some of the areas, but by and large, you still have access that we don't. And so we can continue to pray, we can continue to support, we can continue to give. And so if you're watching this, please go to the Mission Flag website and just click on that donate link and find that designation for the Guimedic and make a generous donation. So we are hoping and looking forward to getting back down alongside you as soon as we can, and look forward to that and continuing to pray and dream together, building a state-of-the-art clinic for the indigenous people that they'll have access to permanently. Is really exciting for us, and so we'll just continue to look forward to those things. So thanks for your time, and I sure appreciate it. Yeah.
thank you for this invitation and for this interview.
Yeah, our pleasure.